Welcome back, everyone. Today, we have an important topic to discuss, the Hib vaccine. In this video, we'll be diving deep into the details of the Hib vaccine, its importance, and the impact it has on our health. So, let's get started. What is Hib? Hib stands for Haemophilus influenzae type B. It is a bacteria known as Haemophilus influenzae, specifically the type B strain. Hib bacteria can cause severe illnesses, particularly in young children, such as meningitis, pneumonia, and other invasive infections. The Hib vaccine is specifically designed to protect against these infections by stimulating the body's immune response to fight off the bacteria. By vaccinating against Hib, the risk of serious complications and even death can be significantly reduced. What is Hib vaccine? The Hib vaccine, or Haemophilus influenzae type B vaccine, is a safe and effective immunization that protects against infections caused by the Haemophilus influenzae type B bacteria. It is administered to infants and young children through a series of injections, starting at around 2 months of age. The vaccine stimulates the immune system to provide immunity against Hib, reducing the risk of severe illnesses such as meningitis and pneumonia. By vaccinating against Hib, individuals not only protect themselves but also contribute to herd immunity, safeguarding vulnerable populations. How Hib vaccine is manufactured. The manufacturing process for the Hib vaccine involves several steps to ensure its safety and efficacy. Here is a simplified overview of the general manufacturing process. Culturing the bacteria. The Haemophilus influenzae type B bacteria are grown under controlled laboratory conditions. These bacteria are specifically selected for their ability to produce the polysaccharide component of the vaccine. Isolating the polysaccharide. The bacteria are harvested, and the polysaccharide component, which is the main antigen of the vaccine, is isolated and purified. This component is responsible for triggering the immune response in the body. Conjugation process. To enhance the immune response and make the vaccine more effective, the isolated polysaccharide is chemically combined with a carrier protein. This process is called conjugation. The carrier protein helps the immune system recognize and respond to the polysaccharide, resulting in a stronger and longer-lasting immune response. Formulation and packaging. The conjugated polysaccharide protein complex is then formulated with other necessary components, such as stabilizers and preservatives, to create the final vaccine formulation. Filling and packaging. The final vaccine is filled into vials or syringes under sterile conditions. The containers are sealed and labeled with appropriate information, including dosage, lot number, and expiration date. Quality control. Throughout the manufacturing process, strict quality control measures are in place to ensure the vaccine's safety, purity, and potency. This includes testing the vaccine for sterility, purity, and the presence of contaminants. Distribution. After QC compliance and regulatory approval, the vaccine is distributed to healthcare facilities, clinics, and vaccination centers, where it is administered to individuals as per the recommended vaccination schedule. How Hib vaccine work? The Hib vaccine works by stimulating the immune system to recognize and protect against the Haemophilus influenzae type B bacteria. Here's how it works. Introduction of the vaccine. When the Hib vaccine is administered through an injection, the body's immune system recognizes the components of the vaccine as foreign. Immune response activation. The vaccine contains the polysaccharide component of the Haemophilus influenzae type B bacteria, which is chemically conjugated with a carrier protein. This conjugated complex stimulates the immune system to respond and produce an immune response. Recognition and memory formation. The immune system identifies the polysaccharide protein complex as a potential threat. Specialized immune cells, such as B cells, recognize the complex and produce antibodies against it. These antibodies can bind to the surface of the actual Hib bacteria if encountered in the future. Antibody production. The B cells multiply and produce specific antibodies, known as anti-Hib antibodies. These antibodies are specific to the polysaccharide component of the Hib bacteria. Memory B cells. In addition to producing antibodies, some B cells differentiate into memory B cells. These memory B cells remember the specific Hib antigen and remain in the immune system, providing long-term immunity. Protection against future infections. If a vaccinated individual comes into contact with the actual Haemophilus influenzae type B bacteria, memory B cell quickly recognize the Hib antigen and rapidly produce the antibodies. These antibodies bind to the bacteria, preventing its attachment and invasion of the body's cells. This immune response helps eliminate the bacteria before it can cause an infection. By inducing this immune response, The Hib vaccine provides immunity against Haemophilus influenzae type B infections. It reduces the risk of severe illnesses, such as meningitis, pneumonia, and other invasive infections caused by the bacteria. Who require Hib vaccination? Hib vaccination is primarily recommended for infants and young children. The specific age recommendations may vary slightly depending on the country or region. However, in general, the following groups of individuals require Hib vaccination. Infants. Hib vaccination is typically recommended as part of routine childhood immunization schedules. It is often administered starting at 2 months of age, with additional doses given at specific intervals. The exact schedule may vary depending on the specific vaccine formulation and guidelines of the country. Children. If a child has not received the Hib vaccine as an infant, catch-up vaccination may be recommended. The catch-up schedule will depend on the child's age and vaccination history. Individuals with certain medical conditions. People with certain underlying medical conditions or immune system deficiencies may have an increased risk of severe Hib infections. In these cases, healthcare professionals may recommend Hib vaccination regardless of age to provide protection against the bacteria. It's important to consult with healthcare professionals or refer to official immunization guidelines in your country or region for specific recommendations regarding Hib vaccination. Is there any AEFI associated with Hib vaccination? Adverse events following immunization, AEFI, associated with Hib vaccination are generally rare, and most reported reactions are mild and temporary. However, it's important to be aware of potential AEFIs. Here are some of the possible adverse events that can occur after Hib vaccination. Injection site reactions. Mild reactions at the injection site are common and may include redness, swelling, or soreness. These reactions usually resolve on their own within a few days. Fever. A low-grade fever may occur after vaccination. It is a common and expected response as the immune system reacts to the vaccine. Fever-reducing medications can be given if necessary, following healthcare provider guidance. Allergic reactions. While rare, some individuals may experience an allergic reaction to the Hib vaccine. Symptoms may include hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. Immediate medical attention should be sought if these severe allergic reactions occur. It's important to note that the benefits of vaccination in preventing Hib infections are far significant than the risks of adverse events. The majority of individuals vaccinated against Hib experience no significant side effects. Conclusion. Remember, getting vaccinated is not only about protecting ourselves but also about protecting those around us. It's a community effort to ensure the health and well-being of everyone. That's it for today's video on the Hib vaccine. I hope you found this information helpful and informative. Don't forget to subscribe to our channel for more health-related content. Thank you for watching, and stay healthy.